All right, thank you for joining us for today's event, where we're going to talk about the medical review on the CT scan of the abdomen and the pelvis. My name is Mary Sue Gardner. I'm a registered nurse on the Provider Outreach and Education team, and I will be your facilitator for today's event. And I'm joined today by Jennifer from Provider Outreach and Education, as well as some representatives from the Medical Review Department, who will be assisting with the chat and the Q&A portion of today's call should I need a little help. Today's event is going to focus on the medical review of the CT of abdomen and pelvis. So this targeted medical review actually started in February of this year for our J5 Part A providers. But please note, just because we started this review in J5 Part A, that doesn't mean that J8 Part A providers, it doesn't mean you're completely off the hook. So if we start seeing significant errors in J5 upon reviews, we can re-examine data for our J8 contract and those providers that pose, the highest risk in that area as well. So just know that, anytime we have significant review findings, whether it's us or another medical review entity, those reviews can be then opened up to different areas. And that's why we want to bring you this education at the start of this type of review, so that if you provide these services, you can learn about what Medicare medical review of these services may entail. And so you can make any necessary changes or updates in your documentation to help you avoid potential review errors in the future. A few housekeeping items before we get started. On our website, WPSGHA.com, we have a training center link at the top of the page. In our training center, you're going to find all things education, such as training materials like the slide deck in our live events page, upcoming educational events. You even have access to encore presentations that you can watch outside of YouTube. Those encore presentations are generally on our encore page on WPSGHA.com for about 60 to 90 days, but are always available on our YouTube page until the information is either changed or updated. If you have questions during today's event, you can place those questions into the chat and send those to all panelists. Finally, if you have any feedback about your experience today, there'll be opportunities during the event and at the end of the event to take the survey. Jennifer's going to place a link to the survey in the chat right now. So if you find you might have to leave the presentation early, you always have access to the survey link. If you're listening to the encore of this event or the recording of this event, we also encourage you to take the survey. The encore survey link should be at the top left of the screen. It'll be a little eye with a circle around it. And it's also available in the description of the presentation. But you can also use a link that'll pop up at the end of the encore presentation as well. On your screen is just our copyright notice. We have to give you this notice because we do have CPT codes contained within this presentation. So you can read that at your own leisure time if you so wish. And this is our disclaimer. And this disclaimer basically says we prepared this information as a tool to help you, our provider community. But know that Medicare laws, rules, and regulations always change. So it's your responsibility as a provider to make sure you are following the most current laws, rules, and regulations on the date of service you are providing services to your Medicare beneficiary. So CMS is going to have final determination on all coverage. So if something I tell you today changes tomorrow, it's your responsibility as a provider to make sure you are following the rules that are in place tomorrow. We also ask that you please don't audio or video this presentation for profit-making purposes. Since we don't know why you would be recording it and we are recording it for you, just go ahead and get it from our YouTube if you want to listen to the encore of the event. And then acronyms. Medicare's full of acronyms. If you've participated in any of our presentations, you know that we tend to speak in acronyms as well. So these are the most common acronyms that I may say in this presentation today. If I say an acronym and you don't know what it is, just refer back to this page. If I use one that's not on this page, just go ahead and place that in the chat, and Jennifer or one of my other associates will get that answered for you. All right, let's get into the meat of why we're here. As I mentioned before, my primary objective for today is that you, our Medicare providers, that you learn about the Targeted Probe and Educate review that's being conducted on these services. And that's in an effort to avoid any review findings on your end should your facility be chosen for medical review of these services. We're going to accomplish this objective today by reviewing the coverage criteria for these services. We're going to go through the documentation requirements, and we're going to explain how compliance with the coverage criteria and documentation is going to help you mitigate your risk of having any review findings. So let's start with a little background. CT scans are images produced that actually take a series of x-rays from different angles to create a 3D image. And CT scans have become the primary diagnostic tools for many conditions and symptoms. When medically reasonable and necessary, Medicare will pay for these services because they actually help diagnose and plan and even monitor patients' treatment. They must be performed on approved equipment, which we'll discuss a little later in the presentation as well. Our review is going to focus specifically on CT scans of the abdomen and the pelvis, and that's with and without contrast, because those services specifically are what our data indicated that there's a potential risk to the Medicare Trust Fund. So those are the ones that we are looking at. When these services are medically necessary, Medicare again covers CT scans. The CT scan again have become the primary diagnostic tool for many conditions and symptoms. So CT scans used as a primary diagnostic tool can really be cost effective because it can eliminate the need for a series of other tests. It's non-invasive, and thus it virtually eliminates complications, and it's not a service that requires someone to be hospitalized. When it comes to coverage for Medicare, general diagnostic examinations of the head or head scans and of other parts of the body or body scans performed by CT scanners are covered if medical and scientific literature and medical opinion supports the effective use of a scan for that condition. They again have to be reasonable and necessary for that individual patient on that individual day. And they must be performed on a model of CT equipment that meets criteria with the FDA. And we'll briefly discuss that in a little bit as well. Remember, our review is focusing on the CT of the abdomen and the pelvis with and without contrast. So let's move on and talk a little bit more about these conditions of coverage. And first, we're going to talk about reasonable and necessary. In order for a service to be reasonable and necessary, There needs to be sufficient amount of information provided with your claims to differentiate CT scans from other radiological services and to help make coverage determinations. So a medical review nurse is going to carefully review claims and documentation to ensure that a scan is reasonable and necessary for that individual. For example, the use must be found to be medically appropriate considering the patient's symptoms and the preliminary diagnosis. There is no general rule that requires other diagnostic tests to be tried before CT scanning is used. However, in an individual case, we as the MAC, our medical staff may determine that the use of a CT scan as the initial diagnostic test was not reasonable and necessary because it wasn't supported by the patient's symptoms or complaints that you have in the documentation. An example of that might be all that's documented is periodic headaches, and we have no other information on anything about the patient, about the headaches, et cetera. But documentation for something like unexplained severe right lower abdominal pain that started at 10 a.m. that day, that may warrant the need for a CT scan of the abdomen to examine the appendix, for instance. Remember, claims for CT scans are also reviewed for evidence of abuse, which might include the absence of reasonable indications for the scans. An excessive number of scans could be another thing that might be considered abusive, or even unnecessarily expensive types of scans, considering the facts in the particular documentation for that particular case. When it comes to providing these services, CMS states that you must use approved models of CT equipment. As a MAC, we're going to assume you are performing the services that you're requesting reimbursement on, that you're doing it on approved equipment. That's part of your operating agreement of being a Medicare provider. But there are things that your facility must do to support that you're using FDA-approved equipment. That information is actually contained in the National Coverage Determination, or NCD 220.1. Your radiology department should already know how to do that. But if you wanted to get more information, you can review that information in the NCD. And a link to that NCD is available on the resource page of the slide deck. Before we move on into some of the review information, I want to talk briefly about mobile CT scan settings, and that includes hospital and ambulatory settings. When it comes to mobile CT equipment, there are a few things that you should keep in mind about the setting in which it is performed. First, CT scans performed on a mobile unit are subject to the same Medicare coverage requirements that are applicable to scans performed on a stationary unit, as well as certain health and safety requirements that are recommended by Health Resources and Services Administration. As with scans that are performed on stationary units, the scans must be determined to be medically necessary for that individual patient. So the scans must be performed on types of CT scanning equipment that have been approved for use as stationary units, and must be in compliance with applicable state laws and regulations for control of radiation. So know that all of that same responsibility is still in place when we have mobile equipment as well. So let's first review the hospital setting. The hospital must assume responsibility for the quality of the scan furnished to inpatients and outpatients, and must ensure that a radiologist or other qualified physician is in charge of the procedure. The radiologist or other physician, like the one who might be in charge of the mobile unit, who is responsible for the procedure, must be approved by the hospital for similar type privileges. In the ambulatory setting, if the mobile CT scan services are furnished in an ambulatory health care facility other than a hospital-based facility, like for example, a freestanding physician-directed clinic, the diagnostic procedure must be performed by or under the direct personal supervision of the radiologist or the other qualified physician. In addition, the facility must maintain a record of the attending physician's order for the CT scan performed on a mobile unit. When it comes to billing for mobile CT scans, hospitals, hospital-associated radiologists, ambulatory healthcare facilities, and physician owner or operator of mobile units, they may bill for mobile scans as they would for scans performed on stationary equipment. This event today is not focusing on billing, but you can find more information again on that in our national coverage determination if you want additional information on that. But again, mobile CT scans can also be subject to claim review, and that's why I wanted to talk briefly about that. So there should be evidence of compliance with all the applicable state laws and the regulations, all the controls that you have to have in place for radiation. All those things aren't any different. And again, you're subject to review just as if it were a stationary CT scan. So, again, as we move on, here we go, sorry. We're going to start talking about the review process and why we're actually doing these reviews. As I mentioned at the start of this presentation, in February, we started a review, targeted probe and educate review for some of our J5 Part A providers on CT of the abdomen and pelvis, and that's with and without contrast. So the CPT codes included are the 74176, which is the CT abdomen and pelvis without contrast material, and the 74177, which is with contrast. In these reviews, we're going to be looking for documentation to support the medical necessity of the procedure for that patient on that day with that type of service. If you report the 74177, the one with contrast, we're also going to be looking at your documentation to support that that contrast was actually given. So there's got to be clear evidence documented that states an IV contrast injection was administered prior to that CT scan of the abdomen or pelvis, or that contrast enhanced CT scan of the abdomen performed with whatever specific contrast agent name was administered intravenously. Those are two different ways you could document that. And it should include the type and the amount of contrast. So let us know the route, the type, and the amount. And we need to see that that was performed, you know, those services were performed and documented as you are requesting reimbursement for them. Remember, part of the proof of medical necessity of the service is that it was ordered by a physician that is caring for the patient and has direct knowledge of the case. So this is also supported by a signed, legible order from that physician. And we'll talk a little bit more in documentation of that as well. So why are we doing the reviews? Well, WPS data analysis actually identified these two procedure codes represent a significant risk in the total dollars at risk at greater than 99 percentile, and the total dollars at risk per claim at greater than the 50th percentile when those were compared to other procedure codes within the jurisdiction. Remember, this is J5A. Providers often use CT scans as a primary diagnostic use, and CMS supports that in the national coverage determination. And again, that NCD is 220.1. The reviews that are going to be performed are going to focus on the medical necessity of the scan for the condition documented, and it's also going to verify the use of contrast when the providers bill the 74177. Remember, when it comes to documentation of a service, if it's not documented, it's not done. Your documentation is the link between the need for and the delivery of those services provided. It is necessary for proper payment of the services that you provide. So let's move into these documentation requirements. This slide contains an overall list of the documentation that is going to help support the medical necessity of these services. This is where you can see that Part A facilities and Part B providers must work together, because some of the documentation to support the overall necessity of the service being provided at the facility must come from the physician's office at times. So the documentation includes things like the history and physical or progress notes that support the patient's symptoms and the preliminary diagnoses. So what is leading the physician to believe that this person needs a CT scan of the abdomen or pelvis with or without contrast? We need to see that physician's orders for the service, and the orders should say with or without contrast. We need to see the imaging results. So what are the results of that specific image? We don't necessarily want to see the CT scans themselves. We just need the write-up from the radiologist that gives the results, or the imaging results that were documented by that physician that read the results, that read the imaging. Documentation supporting the use of contrast, if it's applicable. So if you use contrast, you need to document that. You need, again, to document the route, the contrast that was given, the amount of contrast that was given. If there are any problems with the IV site, any redness, any issues, if we have an IV site that's blown, that should also be included in your documentation. Signatures. Signatures are important. We need to see who provided what service, and the signatures are appended appropriately along with the documentation that was appended in the chart. And then finally, an advanced beneficiary notice of non-coverage, if it's applicable. If you issue an ABN to the patient because you have some sort of reason to believe that on that day, for that patient, for that service, Medicare may not pay, then you have the right to issue an advanced beneficiary notice of non-coverage and let the patient know that in the event that Medicare does not consider it medically reasonable and necessary, the patient may be subject to pay for those services. Let's move on and talk about how you can mitigate the risk of getting a denial if you happen to be chosen for a claim review. So these are a list of questions on the next several slides that I encourage you to go back after this and re-review and make sure you are capturing appropriately in your documentation. So are you choosing the correct CPT code for the scan that you provided? If you are doing abdomen or pelvis with contrast, are you choosing the correct CPT code for the contrast? Was the scan performed in an ambulatory setting? If it was the diagnostic procedure performed by or under the direct personal supervision of a radiologist or other qualified physician? Is the attending physician's order for the scan performed, available, and there for a mobile unit? More questions. Was the scan in a hospital setting? If it was, does the documentation support that the radiologist or other qualified physician is in charge of the procedure? Is all required documentation included in the review? So do we have patient symptomology? Do we have a preliminary diagnosis for this patient? Maybe it's a rule-out diagnosis. Do we have the orders for imaging and the results of those imaging? Do we have the documentation to support contrast, as well as if you gave an ABN and signatures? And the big question, is the scan medically reasonable and necessary for this patient on this day? So that takes us all the way back to everything we were just talking about. How do you support medically reasonable and necessary? By patient symptomology, by preliminary diagnosis. Do we have documentation that those things were documented to clearly support that doing the CT of the abdomen or pelvis for this patient on this day is reasonable and is necessary? That's how we're going to get to our end diagnosis. All right, and as I said earlier, on your screen, here are some additional resources. I talked about the CPT or the NCD several times, and this is just a link that's going to take you out to the national coverage determination, as well as some additional information on the medical review section of our website about, you know, a little article about this review of the CPT. Of the CT scan of the abdomen and pelvis. Ooh, too many C words. All right. So let's do a quick recap before we jump into some of the questions that are submitted. Today, we learned about this upcoming TPE review that's going to be conducted for CT scans of the abdomen and pelvis with and without contrast. And we accomplished this today by going over that coverage criteria, where to find that coverage criteria in that NCD. We reviewed what documentation is required, and if you get a request for review, know that your ADR letter is going to come with a list of documentation as well. And then we went through and talked about how can you be in compliance and help mitigate the risk. And you can actually be in compliance by, again, knowing that coverage criteria, knowing what documentation that you need, making sure your documentation really supports the necessity of that service for that patient on that day. And if it does, and you are selected for a medical review, you shouldn't have any problems passing that review. All right. So at this time, I am going to ask Jennifer if she can let me know about any questions that have come into the chat. So Jennifer?
Hi, Mary Sue. Sandra asked 2 questions, so we'll start with her first one. Please clarify, in a hospital setting, must the radiologist provide direct supervision or general supervision of the radiology tech?
And that is general supervision, so your radiologist needs to be on site and needs to, you know, not be in direct line of sight, but be able to assist in the event that there are issues. So that is the general supervision.
Okay, and her next question is it required to have separate documentation to support documentation of symptoms and complaints of both the abdomen and the pelvis?
So if the need arises that you were scanning 2 different sites, but the symptomology and the complaints are the same, we're just not sure if it's quite an abdomen or a pelvis issue, then that documentation is going to support both. And so when you document, you should, you know, encourage your physicians to write to the fact that the need for CT of abdomen and pelvis is due to XYZ symptomology, you know, and give a little bit more background information like we talked. When did that symptomology start? Where is that symptomology? You know, what area is it specific to, et cetera. Vague descriptions are what kills documentation. All right, Jennifer, next question.
Sure. We just got a question that kind of related to the previous one about general supervision. Is WPS looking for a statement that general supervision was provided during the CT abdominal pelvis or the CT abdomen pelvis by such and such provider? So they're looking to know if we're asking for or looking for a statement that general supervision was provided during the CT.
Sure, and generally we don't look for that. That is something that the state can walk in at any time and audit you and make sure you are meeting those requirements. As a Medicare provider of services, one of the things in becoming a Medicare provider, you agree to follow all laws, rules, and regulations. So this is one of those instances where you're saying, yes, we're going to do this service. We're going to have the providers necessary doing the things that they are required to do. And we, as your MAC, generally do not audit for that. That is something that the state can come in and audit for. However, I am going to ask either Linda or Heather to briefly weigh in and make sure I said the correct thing.
Hi, Mary Sue, it's Linda. Yes, I would agree with that. In a hospital setting, if we're focusing on the CT that was completed, we generally will give the benefit of the doubt that that radiologist is on site for that supervision, and we would not look for a statement to state that.
Perfect. Thank you, Linda. All right. And Jennifer, are there any other questions that have come in?
Yes, there are 2 more. If the physician order does not specify with contrast, but the radiologist determines contrast is needed for a study, how should this be handled?
Oh, there is some information in the benefit policy manual, and I believe it's in chapter 15, and I'm not in it right now, but the best thing to do is you go back to that ordering physician and get an updated order. However, there are instances in an emergency that can be overridden by like the radiologist. However, I don't have that information in front of me right now. but in the event that you're doing the scan, that you believe that contrast would need to be given, it is you will need to get an updated order from that ordering physician for those services. Again, unless there's an emergency. And I'm not sure if anyone on my end, any of my medical review staff has that section of the manual, but if they do, I will have them put that information into the chat of where we can find that. I just don't know the exact section offhand, but I'm pretty sure it's in the Benefit Policy Manual, Chapter 15.
Okay, Mary Sue, we have a few more questions. What would you expect to see to support that a radiologist or other qualified physician is in charge of the procedure in a hospital setting?
Again, that comes down to part of the services of your radiologist and what they are supposed to be doing, and it's not necessarily something that we are going to review for. However, the state could walk in and review for it. Again, we're going to give you the benefit of the doubt that you have the qualified person doing the qualified things that they are supposed to be doing in the hospital setting. Unless we start questioning the validity of the fact, you know, something leads us to believe that maybe you don't have the right people, that may be a time when we start asking for additional documentation to support. Maybe seeing if there are charts or whatever we have physician time in, you know, those are times though that you're moving into more fraud, waste, and abuse type issues. But know that if things like that come in question, you could be asked by a review contractor to give that information to support that you had those qualified people there. And the next question, Jennifer.
And before I do that, Heather put into the chat that the chapter you were looking for was the Internet Only Manual 100-02, Chapter 15, Section 80.6.2. In case anyone does not have access to the chat, they can know the answer for that one, where you can find the policy you were discussing with the previous question.
Perfect. Thank you, Heather, for doing that. Yeah, I had the Benefit Policy Manual in the chapter, but I just did not know the section offhand.
Okay, and your last question. On the slide, you said that the order is required for ancillary. Is an order also required for a CT done in a hospital?
Yeah, an order is always required. We need to see that there is physician involvement, and if a patient, whether they're in the hospital or whether they're outpatient, there needs to be an order somewhere documented in the chart of what procedure, if it should or should not have contrast, and what the procedure is for, what's leading us to believe that that is necessary for that patient on that day.
And we just got one more question in the chat. Are electronic signatures sufficient for the order, or does the provider need to have a written signature attached? It was also mentioned about abuse due to excess number of scans. Would it be looked as such if a patient is getting frequent routine scans with a metastatic diagnosis?
Great question. So electronic signatures, 100% allowable. And probably, you know, the most common type of signature that we get now. So yes, as long as, the one thing I do want to caution everyone about is make sure if you are selected for medical review, we've seen in the past where electronic signatures, when you print the documentation to submit for review, those electronic signatures aren't always appended with those orders. So we don't know. We may get a signature sheet then that prints out that has this whole list of just electronic signatures, date and times, but it doesn't necessarily come up with the order for the CT scan. So 100% electronic signatures are allowable, they're valid. We just need to make sure that they append to the orders when you print them. So I always say, you know, do some due diligence at your facility, print a few things, look and make sure that it prints appropriately. And then I did mention about excessive number of scans, and that could be fraud, waste, and abuse. And it's one thing we keep in our mind when we're doing reviews of services. So again, we'd go back and look at that specific patient for that specific date of service and any history that was provided. And if we see something like a metastatic diagnosis that might require more frequent scans than the average Joe might receive for just abdominal pain, if the diagnosis and the documentation makes sense for the amount and frequency that you're doing, then it probably wouldn't be questioned. It would just be questioned if we see the same person getting a scan and we don't really have a reason why in the documentation that multiple scans may be reasonable and necessary for that person. And with that being said, I do see that's the last question that came in, and that does take us to the end of our time together. So in the interest of time, I want to just go over the last couple of slides that are on the slide deck. You're going to get an email. It should be popping into your email box shortly. And this email also serves as your certificate of achievement. So it does have contact hours listed in there if you wanted to use those for continuing education. So please don't delete that email without reading it. If you have a follow-up question and we didn't answer it today, send those to us via email. If you click on this email address from your slide deck, it's going to populate in the subject line, CT, abdomen, and pelvis, or something, you know, similar, but it'll pop in the email address and the subject line, and send those questions to us within the next 7 days. And we'll get those out and answered. And if I feel like it's something that everyone needs to know, I'll send it to everyone that participated. If you need information about a specific claim, however, you can't send that to me. If it's something that needs to go to customer service because they need to actually get in the system and look it up, that again needs to go to customer service. We don't have access to look up your actual claims, and we definitely don't want you to send any protected health information or personally identifiable information through an email. And finally, as I stated at the start, we value your opinion. We want to hear from you and how we did on this event. So I highly encourage you to take the survey. It only takes a few minutes. I really want to know the good, bad, the ugly, what else you need from us. There is opportunity in the survey to tell us what additional education you want in the future. So for no other reason than that, I do encourage you to please take our survey. Read those survey questions carefully, as the ranking order can change during the course of the survey. And then finally, on behalf of myself and Jennifer, as well as all of Medical Review, we want to thank you for your participation in this event. This concludes today's webinar, and you may now disconnect.